Welcome to the Everything Cancer podcast. This podcast is intended for survivors, those who love them, healthcare providers, and cancer support organizations. Our guests offer insight into the honest survivor experience, how challenges are met head-on, and where blessings are discovered. We cover effective self-advocacy on the bumpy road of cancer survivorship from the moment of diagnosis on. We talk about rekindling intimacy when cancer has changed your world. We are given behind the scenes insight into cancer care because understanding it better empowers you to advocate for yourself more effectively. We hear from leaders of cancer support organizations about their resources and how to access them or those like them. The Everything Cancer podcast welcomes survivors who would like to share their journey and how they have met their challenges, providers who would like to share their empowering insight, and leaders of cancer support organizations who would like to share their stories and resources. We welcome support through sponsors, the Everything Cancer website, and our Patreon page. Please note the information shared on the Everything Cancer podcast is not intended as medical advice. Please always consult with your healthcare team. The staff at Everything Cancer podcast will not answer individual healthcare concern questions. Thank you for joining us, and we hope that you enjoy this episode and find it useful. Please do share it with other people if you think they'll benefit from it, and rate us on your favorite podcast platform. Thanks and take care. Welcome to the Everything Cancer podcast, where guests offer insight into the honest survivor experience, how challenges are met head-on, where blessings are discovered, and helpful information is shared. We are so glad to have you here, and we hope you enjoy today's episode. As you know, the information shared on the Everything Cancer podcast is not intended as medical advice. Always consult with your healthcare team. We would love to hear from you, your suggestions for topics or guests, and your comments about the show at everythingcancerpodcast@gmail.com. Remember to rate us on your favorite podcast platform and tell others about our show. Now on to the episode. Hello, everybody, and welcome to the Everything Cancer podcast. We have a guest with us today who is very storied and has an incredible career, and she's taking that career and now she's devoting it towards the cancer survivor and towards nurses to make sure that we have a voice in legislation. Rochelle Prosser, I'm just so impressed by everything she's involved in. But I think you'll be impressed too as you listen today to our interview. Just to give you a little bit of background on Rochelle, I'm not going to go into everything because it's a lot, a lot to unpack. She's a I love how you're laughing, Rochelle. She's a certified legal nurse consultant, which actually helps her to interpret the laws that are being and the legislation that's being unpacked in these meetings. The founder of Orchid Health Solutions and the Prosser Cancer Library, which is a really nice resource. She's also with the Health Information Technology Advisory Committee, and she's the co-chair for the HTI-2 rule, the Health Information Rule. And that's a lot to kind of get into, but it's talking about how health information is handled and how your privacy is protected. But Rochelle, I am so glad to have you here with us today.
Thank you. I'm giggling because I'm not used to hearing about myself. Normally, I'm giving other people their accolades.
Well, you should hear a lot about yourself because when I hear you talk, I am just blown away by how well you understand what's being discussed and how well you're able to articulate it back to everyone else. You explain things incredibly well, and I'm very grateful that you're working on what you're working on.
Thank you so much.
You're welcome.
It is important to understand how the health policies that are being crafted today will affect both the profession of nursing in our career paths, reimbursement, but most importantly, how it affects our loved ones. because everyone at some point is going to receive care in a healthcare facility, whether it's for delivering a baby or scratching a finger and you need a few stitches, or something really more serious and complicated. And what the outcomes of your data, what is the outcome of the notes and the information that is being collected about you in your healthcare stay, who holds that data and how it is shared, it really is the meaning of life and death for some people. And in some
Yes.
instances, like cancer. And so it was important to me to say, somebody's got to be there to represent nursing. We end up having to collect the data, analyze the data, decide how it's going to be shared, do all of these interdisciplinary and shared governance, and then repackage it back for the general public to understand, and our physicians to bill for it. And we are left out of it. We don't get to design what that technology that is going to collect that data is, but we have to reuse it, and then we're responsible for the outcomes, good, bad, or ugly. And
Right.
so maybe for me, it's about autonomy, not only in the nursing profession and as a career, but autonomy for patients. The patient should have the right to be able to direct how, when, where, and who uses their information.
I agree. I agree. And I think the 21st Century Act has a lot to do with patients being able to see things in real time, which I think was a long time in coming with the
Mm-hmm.
with the advent of the electronic health record. What I hope doesn't happen is patients' lack of understanding in a particular situation getting in the way of continuation of care, such as one oncologist to another,
Mm-hmm.
when you are forwarding information, say, to an expert for a second opinion. But I think because that is where you're going for an expert opinion to not in any way interfere with the privacy of patients, but in fact to make sure they're receiving the best care possible. That shouldn't happen, right? Right, Rochelle?
Yes, no, I absolutely agree. There is no healthcare provider out there, from doctor to the person that sweeps the floor and in environmental service, that is using the intention of going to do harm when they're trying to help anyone
Right.
coming into a healthcare facility. And so when they see the need to be able to send a patient somewhere else because they need a higher level of care or a more specialized level of care, that is a time when they come together and really do their best. You call it that healthcare delivery magic. Some of it call it jujitsu. We're going to sit there and make sure that we can get that communication, get all the records together, and send it off with that patient. But in certain communities and in certain age groups, it's on a disc. It's on a
Yes.
CD-ROM,
And it
or
can get
it's on a
lost.
paper.
And it
And
can get
so,
lost.
and it can get lost. And what ends up happening is the doctor and nurse now in that emergency room or that department is chasing the ambulance down the highway to get to the facility. And then what happens when they get to the facility? The software that is reading that CD-ROM or DVD disc doesn't match. And now they got to radiate the patient again. And it's infuriating. It actually can provide delays in treatment
Yes.
and poorer outcomes depending on what you're trying to do. I know
Yes.
that if you have a broken pelvis, you don't want nobody moving you again to shove um, an X-ray tray underneath your
Mm-hmm.
butt when you've broken your pelvis, when you've already gone through the pain of that, and then you've driven 100 miles or 200 miles because you live rurally, or you're coming from Indian Health Services out of your community into the rest of the community, or you're a kid and those services just aren't available.
Right.
So when you look at that, it is so important to discern exactly what do these healthcare policies mean. But most important is to ask that question. Okay, what's in it for me? What's
Right.
the patient? What's in it for me? And what's in it from the nursing perspective? What's in it for us? Where do we fit into this design? Are we the stakeholder or are we the dessert? Right. And so for me, I had to be in that room. I had to be in that room to be able to say, have we really considered every stakeholder? Have we considered every option available? And what are the hindrances, the gaps that can cause a real problem later on?
Thank you for tuning into the Everything Cancer podcast. We appreciate you being here with us. If you are finding this episode useful, please share it with others that you think would benefit. And don't forget to rate us with your favorite podcast platform. Please check out the show notes for more information and more information about our guests, links to their websites, and any other resources they've shared. We aim to make it easy for you to connect and learn more about the valuable insights shared in each episode. We welcome support through sponsors, the Everything Cancer website, and our Patreon page. Please stay tuned for a brief word from our sponsors, and then we'll be right back to our episode. Thank you so much. Do you have a dry mouth that distracts you with that nasty feeling and taste? H2 Ocean has your solution, literally and figuratively, with its sea salt healing rinse. It's made from salt from the Red Sea, and it has other minerals that are beneficial to you in it. It also has lysozyme enzyme, which is soothing to the inside of your mouth, and xylitol, which makes your mouth water. It's very mild in flavor, yet refreshing. Does not make you suck in your cheeks like often happens with other mouthwashes. And it stays with you. Other mouthwashes, they're gone in 10 or 15 minutes. This has stayed with me for a few hours now, and it's great. I plan on using it before every podcast episode to keep my mouth moist without taking distracting sips of tea and so on while I'm talking. The links to the H2 Ocean Sea Salt Healing Rinse will be in the show notes, and then a QR code also on the YouTube version of this podcast. It's excellent to help rinsing with chemo mouth or irritation in your mouth from radiation, but mouth sores and just general everyday use. I find it really pleasant and really helpful to use. I hope you do too. Thanks. I'm glad you're the one there because you get it. You understand it, you understand the stakes, and you're able to very well, I can say, very well speak for all of us. I wish all of you that are listening could understand how good Rochelle is at this. But honestly, we were talking about this before we started the interview. Your legal nurse consulting background really lends itself to this. It set you up to be able to do this beautifully. So thank you for that background. And when I initially approached you about coming on to the Everything Cancer podcast, it was to talk about the moonshot, the cancer moonshot, which I'm really excited about, but people probably read about it here and there and don't really understand what it means. They're probably thinking of a rocket taking off, and that's kind of the analogy that's being made. But what is the moonshot? You're very involved in it, and I think, and it's here for survivors. It's here from the time of diagnosis on through the continuum of care, in one way or another.
Mm-hmm. Yes. So I first heard about the Cancer X moonshot when my daughter was 6 and her cancer treatment wasn't working. And there was this crazy one-of-a-kind drug that was out there that might, maybe, possibly, you got a 0.00018 chance that it might work. And I'm like, okay, well, it's better than what we got now that is 100% not working. So, and so we tried it, and it worked. It worked for a limited period of time, but it worked long enough for technology and medical science and medical advances and medical education and eventually drug development and not just any kind of drug development, targeted DNA and RNA development to be created that actually put her on that path. And so I said to myself, if I ever get a chance to be able to give back, because our journey was 10 years with her, and she's very much in recovery. She's very much in remission permanently, and we are forever grateful. But during that time, my husband was also diagnosed about a month apart from her, and we had to choose who we were going to help. 4-year-old and a 52. Obviously, there's no choice, right? You're going to help the one that can't help themselves. But adults can't help themselves too. And there are some adults out there that do not have any help. So and any support. So the Cancer X Moonshot is a public and private health partnership that bring in corporations, individuals, well-intentioned clinicians, doctors, and lay people of the general public. It doesn't matter where you are. If you have a pulse and you have an intention and you have a company that really wants to use digital technology and infrastructure in information gathering, health data sharing, privacy protection, and cancer health equity, this is the group for you if you want to make real change. What they're not doing is saying we're only going to keep it centralized in academia or healthcare centers. We want all participants in every walk of life, in every station of business. We want to partner you. We are part of the government, and we want to partner you. And this is the initiative from the president. And he wants to eradicate or decrease the suffering in cancer by 25% in 30 years. And that was 5 years ago. We're 5 years in. And look at where we are today. We are a community of 300 businesses, corporations, individual consultants, doctors, nurses, caregivers, and cancer survivors, all working towards the same goal, eradicating cancer within our lifetime, and using digital health and technology to do so.
In addition to your daughter, what are some of the really tremendous things you have seen through the Cancer X Moonshot?
Oh, man. So
I know I put you on the spot with that question. And if you want to come back to it, that's okay. We can come back to it.
Well, there's something that they actually on April 27th, they are actually doing a release of a cancer health equity and financial toxicity program that you can bring to your healthcare center or your own practice, or as a caregiver, utilize and say, hey, in my support group, let's start talking about this. And it's a free tool and resource to help people navigate the throes of cancer, because where you start financially in cancer is not where you end up.
Right.
And where you start practicing with the cancer, God love you if that's the same one and it works. But when it doesn't, if you don't know where to go, how do you find answers? You don't even know how to articulate the next question. What do I do next? And so they have these resources here for you that are free, that you can work with hospitals and healthcare facilities to encourage them to practice this, to remove a lot of the patient burden and the financial burden and the caregiver burden in the journey of cancer. So that's why I was smiling, because this is an opportunity to share this publicly for those that are in need.
Yes.
It doesn't matter where you are.
Financial toxicity is real, and it changes lives, not for the better, that's for sure.
I think I remember receiving my first 7-figure medical bill. Oh. And then and after rocking in the corner for about 3 hours, I realized, oh God, it's going to come back. Another one's going to come back in 2 weeks. I could sell everything I have.
And not even make a dent in it.
No, I would make a significant dent. I live in Miami, okay? So, but no, I would make a significant dent on that bill. But then what comes next? And now I'm living in a car with my 3 kids and my and 2 sick cancer patients, my husband and my daughter. It wasn't sustainable. And so people need to know that you don't need to liquidate every asset that you have at your fingertips and disposal. You should not be having fire sales of the contents of your house.
Right. You shouldn't end up living in a car. And when I worked at an infusion center, I worked with people who lost their homes while they were being treated.
Yes. Yeah. You should not have to go through that level of depravity just to save your life. It's wrong. It's immoral. And so we are a community of well-intentioned people, and sometimes the road to is paved with well-intentioned people. And so this is why health policy is important, to be part of that, and we help to direct and craft that health policy and work directly with the White House to ensure that we're doing the right things for the right time for the right reason. No one should have to be the worst versions of themselves, including mental health, because you're suffering, there's trauma in doing this. And so you should not be the worst version of yourself while just trying to save your life. No. And so I'm passionate about that, as you can see.
Yes.
The other thing that we do is we want to find technology to find these precursors, to find these DNA markers or antigens. I'm going to say a whole bunch of names. It could be, they were just looking at a virus recently that is causing, or the cause of, some cancers, HPV for one. And now we have an actual vaccine. So it's the early intervention and then doing the booster shots through middle age is what keeps us from having these unseen, unfelt, but very devastating cancers that are harder to treat. And so we want to see how we can use technology to the benefit of everyone.
Yes, there's a lot of link I'm seeing now through research publications I'm reading between viruses and cancer.
Yes.
And that's really interesting to
It's
see that.
interesting.
And viruses are being used
to cure them.
To cure them,
Yes.
which is also interesting.
Yes.
And it's a fascinating world that we're in right now with the immune system and fighting cancer.
Yes. And here's the thing. We're crafting drugs. Let's put it in the real perspective in the real world. I mean, we have alphabet soup of all of these drugs and targeted therapies and letters and alphabets that we have, right? But let's break it down to what it really means. We're looking at your DNA structure, and there's something in it that is targeted just for you. You are a party of one, and this drug is targeted just for you. But then when we find out that it works just for you, we can then go and look through other people that have the same type of cancer to see, do they also have that as well? So now it doesn't end up being so rare. Is it a rarity? Yes, it is. But for those in smaller communities and spread across our great nation, we may be able to find something that works for you. This is why it is so important that we give our do a biopsy and share that tissue to have research, to look at those biomarkers. I would be the first one to say, because of history of our country, I was not reticent to do that for a multitude of reasons. But where we are today, if we don't have a proper tapestry of all the representation of all of us in this great, illustrious nation, none of us are going to survive cancer, because it's becoming a chronic disease. And just as I say, a party of one, if you're not testing in that community, if we don't have the DNA markers from those communities, if we don't find those unknown genetic drivers, you cannot keep large swaths of the population separated and isolated and think that all of us are going to come together in cancer camp and cure cancer. It's just not going to happen. So it's important to donate your tissue.
It is. I mean, I didn't realize how important it is until you brought that up. Wow. And you brought up, I mean, you have a very tangible example in your daughter.
Yes.
If you don't mind sharing that story. If you don't want to, I get it. But you have in that you had found a stage 4 clinical trial for her that was successful.
Correct.
And you had asked who, so I'll let you tell the story, but it really brings home why donating your tumor tissue is important.
Yes. So at the time, back in 2014, there was really no cure for pylomyxoid astrocytoma. Astrocytomas of the brain are one of the most common cancers that are found in children. And they classify them as low grade or it grows slow. And so you'll watch it over time. And if it's operable, you mostly leave it alone until you don't, and then you take it out and and then it's intensive rehabilitative services. And because the brain is more pliable in the child, they go on and live successful lives or, longer. But her timeline, I was told, if she makes it to 10, then we'll do radiation. But she's 4. And so from 4 to 10, it's an extraordinary long time in cancer until it wasn't. And so we were trying different drugs and they just weren't working, and she was failing fast and she was really deteriorating. So I wanted to more focus on her quality of life. And so we took a sabbatical just so that, because she needed to have brain development, she needed to have socialization. You're 4. If there's certain things that you must do in terms of socializing yourself to the world, if you don't do that, you won't have the right social cues. You won't be able to have proper communication and be able to function in society. You'll be really awkward, or it's just not going to work for you. So we had to take a break rather reluctantly and go into palliative care and hospice care in order to let her start school, to let her start socialization, to let her start being a functional and appropriate person in society. By doing that, that meant that she could die during that process. But she deserves the right to have a quality of life that is not pain and suffering. And as a parent, you're navigating that. So we went for a second opinion to a very large health center in the New York area. And while we were there at the second opinion, her VP shunt, there's a shunt that moves the cerebral fluid around, and her pathway was blocked by this massive tumor that she had in her head. And it failed. It failed from the airplane. And so just before we were leaving, she looked like this little Buddha. So we had to rush her to the hospital. And lo and behold, when they replaced it, 4 cells from the center of her tumor that we were told was dead, but clearly if I'm getting a second opinion, there's something going on. 4 cells they were able to retrieve that were alive. And of the 4 cells, they did a replication, and 2 cells were able to replicate. But one of those cells, just one, had the full complement of her DNA strain for this type of cancer that she had, which was pylomyxoid astrocytoma. But hers was completely different. It didn't have the BRCA gene markers. It didn't have the KRAS. She had some, but not all of it, right? Not the markers that you can operationalize. She actually had GBM. She had DIPG.
Oh
but
my
she
gosh.
did not have the H1 marker that makes it very resistive to radiation, specific radiation, proton beam radiation. But what we also found was she had this crazy FGFR gene, which is a faction growth human receptor. But it wasn't just the fact that she had that receptor. She had all 3 of them, which is extraordinary. You would not normally find that in a tumor. And not only was it high enough in the DNA chain, it was actually leading and driving all of the changes and the aggression that we've seen, to the point they had to unclassify pylomyxoid astrocytoma from a stage 3. It's now unclassified because it's unique to every individual. Throw spaghetti at the wall, that's what the pylomyxoid astrocytoma is. The conventional thought was it would turn into a cystic kind of way, and then we would treat it like everything else. Hers didn't. It didn't. It stayed solid.
It was aggressive.
It was extraordinarily aggressive.
Wow.
And it was in an inoperable place. in her brainstem, the processing centers, the cellular regions, the optic nerves. It just was everywhere. It was just massive. The corpus callosum, the pontine, the cystine. It was just everything. And what are you going to do? You can't cut it out. Like you may as well just say, let me just get you ready for your funeral process, because you're not going to survive. And if you do, you're not yourself. You're not going to talk. You're not going to walk. You're not going to speak. You can't manage your respiration. You can't manage your heart rate. You're just not a person. You're just a human body in a bed. And I was not going to do that to her. So there's this funky little FGFR gene. And we're like, well, how bad is it? And when we took her blood panel and looked for that in the cells of her blood, it was everywhere. And so I had a choice. It's time out, tap out, PS90, deuces, I'm done. Or do we try a Hail Mary and take this experimental drug that was just starting on human trials? And there was only 4 or 5, and they were all white boys. And she was the first girl to try it, and I insisted that they extend it to more people of color. And that drug was W1347. It broke her long bones. It took the femurs off, the head of her femurs off of both sides, and put her in a wheelchair for 4 years. But what it did do was it took that cancer down from the hair on her head to the toenails on her feet. And the only thing it didn't take away was the big mass in her brain, because it couldn't get there. And I'm forever grateful for finding that needle in the haystack that is now called the Matinib series. But she started that process. And it's a stage 2-3 clinical trial now. Last year, they did a whole talk at the Society of Neuro-Oncology and presented her case. And we talked about the hyperphosphatemia that comes with this drug. What they are now finding is when used for the gut, the higher phosphatemia that you have is the more the drug is working and beneficial to the body. But it comes at a cost. You have neuroplasticity that you lose. You lose nerves. Your nerves endings don't fire the way that they're supposed to. And it actually causes osteoporosis. And so the trade-off, can we fix this with another medicine to keep her going? And okay, you put her in a wheelchair until she can heal, or do you stop the drug and let her go? So we did it, but we watched her closely. And fortunately, I had a group of physicians and clinicians there. And if you can find an ally when you're on a clinical trial, use that person to be your spokesperson. Even the person sweeping the floor can be your spokesperson and advocate in that case, because they want to hear the voice of the patient. They want to hear the voice of the family. And her name was Stephanie Vitellano, Dr. Stephanie Vitellano. She was a nurse practitioner. And I'm forever grateful to her, because we sat down and we went through it. Is anyone else experiencing the things that Kayla is experiencing? Hey, we got to do something about this pain. It's extraordinary. I shouldn't have to be giving 4 Dilaudid. That's too much. And 1 Dilaudid will probably put me in the grave, but she's on 4. So let's look.
And she's little.
And she's little. She's little. She's 8. So let's look at this. Let's look at the pain and cancer. And so the takeaway for me on that is, there are things that people don't know are out there and available to you, but you don't know about it because you're in your community. Mm-hmm. And not everyone can do cancer travel tourism. That's what I call it. That's what it is. If you are going to be, by any means necessary, you are practicing cancer travel tourism. Not everybody has the financial means. I know I did not. I had to use the stock market to make it work for me. Yes, I did. I used my employee stocks and bought them and sold them to keep my daughter in treatment so I wouldn't have to see these 7-figure medical bills. But not everybody knows to do that. Not everybody has to, you have to become your financial planner to save your life. That's wrong, And so that was one of the takeaways for me that I had to change, that I was bound and determined to change. The other thing was patient-reported outcomes. If the patient is saying that this is happening to them, we need to believe them.
Yes, we do. We do. We
like
can't say, what do you mean? Or
no,
it can't
not
be.
What you mean? They are crystal clear. The
Right.
diarrhea is killing them. Okay.
Right.
The vomiting is killing them. It's wrecking their ribs.
And I'm sure everybody listening is saying, yes,
the
yes,
is cutting them to their soul to the point that they just don't want to speak and breathe. I mean, it's the little things that become the grander scheme of the process. And I said, for my daughter, for me, it was more important for her to have a quality of life. I would rather her be blind in a wheelchair, and actually we started preparing our home for that child. And then we had proton beam. The proton beam was brought to Florida, and she was patient number 101 at Miami Cancer Institute. Thank you, Dr. Matt Hall. I think I terrorized the National Institute of Health.
But she was your child. That's why.
I have no shame. I have no shame in saying that, and I'm okay with that, because at the end of the day, we want to give the people, we want to give our cancer patients drugs or therapeutics that are going to support them, maintain them, or heal them, not hurt them, and definitely not kill them, right? Is there a pain in the treatment of healthcare? Yeah, there is. Some of it is seen, a lot of it is unseen.
A lot of it's unseen. And that's one of the reasons why self-advocacy is so important. And patient-reported outcomes, or reporting your symptoms, is so important, because the drugs may actually be killing you, and you're not communicating it because either you're waiting till your next appointment, or you are articulating it. And I'm not laying this on the patient. Believe me, listeners, I'm not. You're not articulating it in a way that it's getting through to your doctor that this is really causing issues. And I've seen people lose 20 and 30 pounds in weight, and the treatments continue, and maybe the dosage is dropped, but sometimes you wonder, should there be another conversation here about maybe switching when you see the reserve disappearing?
Well, here's the thing, right? Because that happened to my child too, right? You're 4 and you're still in 2T clothing. You should be in 4T, right? There's certain stages as you grow. As your age, you're wearing the same clothing size, right? When in months, the same number, right? In toddler, the same year, the same toddler. As young children, that number, you're 6, you're wearing a size 6. You're 7, you're wearing a size 7. You're 8, you're wearing a size 8. And so depending on what the drug or the choice of treatment that you have, you could be losing massive amounts of weight, or you could be putting on massive amounts of weight, which causes something else as well, which is why it's so important to include all of the services of the specialty care.
Yes.
The cardiologist, the endocrinologist, the liver doctor, the dermatologist, you need to have all of them there, because side effects will happen. And when they do, if you're only focusing on the cancer and not the normalcy and normal functioning of the body, you'll miss something. And that missed something becomes a greater issue, and then a chronic care navigation or management issue. Then they have to come to us nurses for the rest of their life. Why they just survived cancer. Why do we want to give them something else? We need to stop digging sometimes. And so, I use humor to talk about difficult things, because it's difficult at the time. And you need a team, you need that support service, you need other people to see the bigger picture. Even I, as a healthcare provider, tried not to go into these doctors' meetings alone. Because imagine you're a healthcare provider, you know more than the average bear. I'm not Yogi. I'm not Yogi. You know more than the average bear, right? And so now they're talking about, oh, I'm going to give you this steroid, and all you hear is steroid, and now you stop listening to the rest of the conversation. It's like, okay, what other organs is this going to affect? And what's the long-term effect of taking these steroids that we're not talking about? Fertility. Even in boys,
Yes.
they are going to lose
Yes.
that. We need to have a fertility plan. We're not
Right.
talking about these things. You have a woman who just gave birth and found a lump in her breast, and now she's on chemoactive agents. She still wants to have children. I'm pretty sure her husband does too, or maybe they don't. But regardless, we're taking choices away from people at a
They need to
time.
have a choice.
They
Right.
need to have a choice. They need to have options. And so this is my vision, and I'm speaking clearly from myself. I'm not talking from the office of the Assistant Secretary of Tech Policy. I am not talking on behalf of the Office of the National Coordinator. For those that know me out there, I am not talking on behalf of my government services that I do. I'm talking about as a human being that has gone through 15 years of cancer and had a front row seat to the
Yes, you did.
worst moments and the worst things, but yet also the best things, and watching technology advances catch up to where we are, that ultimately cured my daughter, that ultimately cured my husband, and that I hope and pray will cure my father, right? And so I have hope that in this cancer journey, there will be dignity brought back within it with these medical advances that we have, and technological advances and research advances. The most important thing that I look at is making our healthcare systems the better versions of ourselves. Let's make our primary care physicians in cancer survivorship, because we have to go back to them. Our oncologists are not responsible to do our pap smears and all of those, our EKGs, and looking at cardiology health and making sure we do smoking cessation and all of these behaviors that we do to just survive, to have a better quality of life while we manage to just get to the next day in cancer. And for some people, they don't feel anything, right? But we still have scars. We still have underlying issues
Yes.
that, even though we have that phrase, everything is right, there's that allostatic load that's working on us that is really harming us in the stress. And so
Yes.
we show it in weight gain and all of these other behaviors that we do. And that's where the primary care physician comes in. But then he has to deal with, what have you taken and put in your body that has caused all of these things? And believe me, he's looking at this saying, yeah, I know Latin. This is not Latin. You know, what happened? And we could have a conversation, but it's going to go woohoo. And we're expecting them to pick up the mantle to continue to heal us in our journey, because that's who we know. And I just want to equip them to be that hero,
Mm-hmm.
that cancer survivorship hero.
Yes. Well, and you and I are working along with some really wonderful people
Mm-hmm.
through the Cancer Survivorship Provider Network
Mm-hmm.
to really help equip our healthcare providers with the
Mm-hmm.
tools for
Yeah.
survivorship.
Yes.
Because the oncologist specialty is oncology. They're there to
Correct.
save your lives.
Correct.
That's where their bandwidth is.
Mm-hmm.
And yes, they're going to help with symptom management while you're being treated, but also while you're being treated, you can lean into integrative oncology as
Correct.
long as you're dealing with an expert, but that's integrative.
And there's a time and a place for it. It's
Yes.
not for everyone.
Right.
Listen, we hear these terms, and it's like we have these beautiful experiences, and we see our celebrities and others out there that have great experiences, and some that don't. But again, how we choose to heal ourselves is up to us. when you have the appropriate access knowledge
Right.
of what it's actually going to do and what it's not, right?
Right.
When you have cancer, that's not the time to do preventative medicine.
Right.
You need an expert. You need somebody who
Right.
knows what they're doing.
Right.
And so there's a
But
time and place for everything.
exactly. Palliative care are
Mhm.
experts in symptom management. They
Exactly.
think outside the box, and they'll oftentimes work with your oncologist. And some integrative care experts are being pulled into that space to help too with
Yes.
symptom management, but you need to make sure that what you're doing is safe with your
Yes.
treatment. So work with your clinical oncology pharmacist, work with your radiation therapist, your radiation dosimetrist, your radiation oncologist, work with your surgical oncologist to make sure that what you're doing is safe.
Yes.
But there's the Society for Integrative Oncology that is really collaborating now with
Yes.
ASCO, which is the American Society
Yes.
of Clinical Oncology, and they're collaborating with the NCI because they are looking at that space of accessible symptom management.
Yes.
And NCI is looking at mind-body connection too. They're finding that people that practice mind-body connection during treatment, which is meditation, yoga, Tai Chi, they do much better because they're paying attention to their bodies, and they're also getting exercise, which is stress reduction. But that brings us back to the Cancer Survivorship Provider Network, the space of moving from the acute phase of treatment into the maintenance phase,
Yes.
and so on, and where you are working on regaining, and also your phase of where you're working to regain your health
Correct.
after the acute treatment.
Yeah.
And you really, so hopefully you have worked to maintain your health during treatment as much as you possibly could. PCPs, I think, are finding themselves pulled more and more into this space.
Yes.
Cancer Survivorship Provider Network, which I'm very thankful for, is working very hard to provide information now
Right.
that will be soon accessible to PCPs and to other people that are out there. Your physical therapists, your oncology rehabilitation specialists
Yes.
are great.
Very important.
Yes, are great for this.
That rehabilitative medicine doctor is truly your lifeline in getting yourself back to function.
And we need to bring the payer into this picture to really support rehabilitative medicine, and not look at it as a service to be limited, but rather a service to be supported for better quality of life and better wellness. It's an investment for years down the road of doing better.
Well, when you think about it, look at what happened, my experience. We were using rehabilitative medicine. What we didn't realize is that she was walking on 2 broken legs.
Oh, yeah.
Because her pain tolerance was so high. In a child doesn't know what abnormal is. They just see their life. And, they get the cancer treatment and they feel bad for a moment, and then it goes away, and then they're up running around. They're more adaptable to cancer therapies because they don't know what they don't know. But when that child comes out of remission and has to do it again, that's when the struggle occurs. That's where the body autonomy and I want that control occurs, because they remember what happened before. And that's more like the adult. Adults know what that pain cascade is. And so if we don't intercede and make sure that we are doing all that we can to keep ourselves as healthy as we can, there are many clinical studies to show exercise is the true benefit, because you can remove the excess cancer drugs from your body by doing exercise. And then it doesn't linger, it doesn't stay in your body as long, and then you have better tolerance of the treatment. And nobody wants to tolerate anything, but I mean, at this point, take the drug or die. So you want to do what you can to make it easier on yourself. And yes, there are things in integrative medicines that other countries do quite successfully, that if we bring it here, under the guise of that expert who has done it, to make sure you don't hurt yourself. That's the most important thing.
Right.
Do not try something because you saw it over there and you're desperate to relieve your symptoms. Get the actual representative to come into your care team and work collaboratively, because sometimes those things that you're trying to do actually work opposite to what your cancer treatment does, and you do yourself a disservice by choosing the wrong thing.
Right. It's safety is imperative.
Yes.
And your clinical, we had an episode about 10 episodes ago. Your clinical oncology pharmacist can be your best friend. With looking at what you can do to boost your health and when to time supplements, vitamins, anything that you want to take to help maintain your health. They're going to work. That's their wheelhouse.
Yes.
Is the interactions and to make sure it's safe and not going to interfere, because if you take something that interferes with, obviously you're not going to do that on purpose, but if it interferes with your treatment, you're going to experience all the toxicity and possibly decrease the curative effect. And you don't want to do that.
No,
so
you don't want to do that.
Rely on your clinical oncology pharmacists. They are true superheroes. They're super smart people.
Yes. And your dietitian.
Yes, and your dietitian.
Your diet sometimes will keep you out of harm's way, especially when it is known that it targets certain things or advances or collects certain types of minerals in your body. And so you have to be very mindful and very careful on what you eat so that you don't cause it to rise abnormally because of the food that you're taking in. And also some of the foods can heal you as well. And so working collectively as a full interdisciplinary team, it helps in that survivorship journey. But not everyone out there has access to all of these resources and even in urban centers, depending on where you are, you may not have that. COVID had taught us that. You're right here in the city where all the skilled workers are and all the skilled health professionals are, but they're not in your hospital. It's the same thing. The drug is there and it's all around you, or the therapy is there and you're seeing in other states, but it's not available there in the hospital that you're in. So I just want to educate people to say there's more out there. Ask questions.
Yes. Ask if there is a dietitian that you can do a televisit with, that's with your Cancer Institute. Ask if there's a rehabilitation oncologist or an oncologist rehabilitation therapist or a, say, pelvic floor physical therapist. If you're having issues with pelvic pain, incontinence, things like that. If you, someone that works with you with lymphedema, get a referral for that. That therapists are amazing with lymphedema, and it's important that you are aware that it's happening and you get it addressed sooner than later. And that can happen after radiation treatments. It can happen after surgery. Yes. And so that's symptom management, getting in front of it and really building your team around you and asking questions, reporting your symptoms, asking questions, looking up who can help with that, or talking with your doctor, talking with the advanced practice provider, such as your CRMP, your physician assistant, talking with your nurse navigator, your infusion nurse, your radiation nurse, who can help with this. Can really make a big difference. And then finding out how to access them. Your support group too.
Yes.
They know who helps. They know all the secrets and all the tips and tricks. So that's even more of a reason to join a support group. That shared experience is amazing, and they'll give you all the deets. Trust me.
Yes, they will. Yes, they will. And I am very fortunate to have one of those cancer moms say, "Hey, you need a support group.
Yes,
you need to get yourself in order." And that's okay. It's okay to not be okay. And it's
Yes.
okay to say, I need help. And it's okay to ask for it. But for those that are out there that are alone, that don't have a support group, that are more than 50 miles away from any healthcare center or medical professional, there is still help out there for you. Just ask, find a virtual community when you go
Yes.
to your center. Ask there.
Yes.
They can provide services for you, even if it's sitting on a video call. Something is better than nothing.
Nothing. Absolutely.
And you are not alone in this.
That's the most important message, I think, is you're not alone.
Mm-hmm.
Cancer Acts is all about not being alone.
Not being alone.
Nursing is all about not being alone. And the cancer support community is about not being alone.
Yes.
Rochelle, it has been amazing. We could talk for hours.
Yes, we could.
And it's been amazing having you here today. Thank you so much for your time.
Thank you for having me here and allowing me to use this platform and your platform. If you have not gotten Jill's book, you've got to get this book. You have to get this book. It's about cancer survivorship, coming from a nurse navigator that has been there more than 30 years. If you want to see wisdom in writing, that's the person right there. Get that book.
Thank you, Rochelle. I appreciate it. I appreciate it very, very much. And you're going to be getting a copy of it. Signed. So I can't wait till we have you back. I can't wait to have you back when we have more developments and to catch everybody up on those. And you are so passionate and you explain things so well. You're the great explainer. So
thank you so much for this opportunity. It's always a pleasure just being able to have a moment to talk with you without everything else around. So
thank you. Everybody, thank you for being here with us on the podcast. We hope you enjoyed this episode. Take care. Thank you for joining us on this episode of the Everything Cancer podcast. We hope you found the conversation as insightful and as inspiring as we did. Remember, all the details about our guest, including their contact information and links to resources they've shared on their websites, will be included in the show notes. If you've enjoyed this episode, please consider supporting us by visiting our website, checking out our Patreon page, or becoming a sponsor. Your support helps us to continue to bring you these important discussions. Don't forget to subscribe to the Everything Cancer podcast on your favorite platform and follow us on social media. Always remember, the information shared here is not intended as medical advice. For any personal health concerns, please consult with your healthcare team. Thank you so much for listening, and we look forward to having you back with us again next time. Thank you for joining us on this episode of the Everything Cancer podcast. We hope you found the conversation as insightful and as inspiring as we did. Remember, all the details about our guest, including their contact information and links to resources they've shared on their websites, will be included in the show notes. If you've enjoyed this episode, please consider supporting us by visiting our website, checking out our Patreon page, or becoming a sponsor. Your support helps us to continue to bring you these important discussions. Don't forget to subscribe to the Everything Cancer podcast on your favorite platform and follow us on social media. Always remember, the information shared here is not intended as medical advice. For any personal health concerns, please consult with your healthcare team. Thank you so much for listening, and we look forward to having you back with us again next time. And for anybody that you have invited to join us, please reach out if you would like to be a sponsor. We would welcome you. Thank you.